Hi everyone, I'm a physiotherapist, Dr. Yashi Bansal, and I am Masters in Neurosciences. Today I'm here to discuss about electrical muscle stimulation. Before starting to teach you what is the correct time and way to use the electrical muscle stimulation, or either you are suitable for the electrical muscle stimulation or not, let's talk about electrical muscle stimulation. So basically, electric muscle stimulation stimulates muscle using tiny electronic impulses via electrodes, and this machine rhythmically contract and relax the muscle, allowing it to work or tone the muscles. So with the help of Faraday current, you can stimulate motor nerves directly at the motor point, which helps to contract the particular muscle. So I am emphasizing of giving the intermittent galvanic current because this is the only form of electrical current which is interrupted direct current, and this can preserve the bulk of facial muscle and to prevent their atrophy until reinnervations or reconditioning completes. Now let's move on to the precaution you should follow while applying the electrical muscle stimulation in the Bell's palsy. Number 1. Turn off the unit when removing the electrodes. Number 2. Do not use over the eyelids. Number 3. The device should not be used over the skin eruptions or swollen and infected or inflamed area. Number 4. Adequate precautions should be taken for patients with heart problems. So this is the general information about the electrical muscle stimulation. Now I'm going to discuss about do's and don'ts. Let's start with how and when to apply the electrical muscle stimulation. Number 1. Always use intermittent galvanic current as we have discussed before. Why? Number 2. Valerian degeneration occur by 14 to 21 days. That's why always starts applying electrical muscle stimulation in the case of Bell's palsy after 2 to 3 weeks later. Number 3. Always use for 4, 5 and 6 grade Bell's palsy according to the House Brackman scale, as I have already discussed about this scale in the previous video. If you didn't watch it yet, link is in bio. You can go there and learn more about the Bell's palsy. Number 4. Always give electrical muscle stimulation in sitting position in front of the mirror for the feedback. Number 5. While using electrical muscle stimulation for the individual muscle, ask patient to do the same muscle function. Number 6. You can give 30 to 50 contraction at a time for single muscle. Now move on to the points which you should avoid. Number 1. Stop giving electrical muscle stimulation if you see even a slightest muscle contraction has started. Number 2. Don't overuse electrical muscle stimulation as it causes muscle tightness and synkinesis. So the synkinesis is an involuntary movement accompanying a voluntary one. For example, while smiling, the eye on the affected side moves towards the partial closure, whereas the unaffected eye remains wide open. Thank you everyone for watching the video. Stay healthy and stay connected.